So now I'm going to talk about other procedures, that some of which are non-surgical, some of which are lunchtime procedures. You may hear that term. And we'll discuss injections as well. Chemical peels. I'm a big fan of chemical peels, but a peel is not a peel is not a peel. There's well over 100 different types of chemical peels. I probably offer 10 or 20 different types in my office. Chemical peels have been around for a very long time. If you go back to ancient Egypt, the women used to, give hints to themselves that if they bathed in sour milk, it would give you a more youthful appearance. And of course, sour milk has lactic acid, and it would freshen the face and make the women more attractive. This is one type of peel that I use. This is an Obagi blue peel. Obagi is a dermatologist in California. These slides are from him. I don't have many patients that ask only to have one half of their face done. So presumably this person worked for Dr. Obagi. So you can see her on the left, and you can get an idea of what she looked like. So somehow he convinced her to only do one half of the face for purposes of illustration. And here and it's not such a great photograph, but I think you can appreciate that on the left side of the screen, her right side of the face is a little bit more shiny, and the skin looks just younger and healthier and prettier than the other side. Again, another one of his patients. This is a patient with acne scarring, and we will talk more about acne scarring in a few minutes. But here she is at the time of her blue peel procedure. She has a diffuse, an even blue peel, and so you can tell already she's going to have a good result from this procedure. And so here she is after the procedure. Again, the blue peel is only one of the procedures I offer. We offer even lighter peels than that. We offer salicylic acid peels. We offer Jesner's peels. We offer glycolic peels. But there's many, many different types. But bar none, my favorite peel is a Heder facial resurfacing peel. Gregory Heder was a plastic surgeon who has actually retired to Florida. But he came up with a peeling solution, and he gave for the first time, he gave these deep peels a way to modify the strength so that you could apply different strengths of the peel to different areas of the face. So you can modify it so in certain areas you go deeper than in others, and you also modify it to the particular patient. So I like to think of it as very analogous to laser facial resurfacing that we will discuss later, but I like the Heder resurfacing procedure even better. This lady is only 51 years old. She was in the sun a lot, and you can see the deep, deep creases and lines that are above her lip. And we used to call those smokers' lines, but we know now that we see them in non-smokers as well. The beauty about a Heder resurfacing procedure is that, and there aren't too many things I will say this about, but the results from that procedure are permanent. And it's truly almost a miraculous procedure. If you take a look at this lady, maybe she's 70, before and after, we did the Heder resurfacing at the time of a facelift. She had a great result from the facelift, but without a doubt, I think it was this improvement that really, really resulted in tremendous facial rejuvenation for her. I've seen other patients where other doctors are giving Botox to these lines, which I absolutely don't agree with. I see other doctors put fillers in these lines, which is okay, but not fantastic. But there's no better procedure than this for this kind of problem. Again, a younger patient that I showed earlier, and so we can modify the strength of the peel. This patient does not need the same strength as the previous patient, but nonetheless, you can see a tremendous improvement in rosacea, tremendous improvement in uneven pigmentation, a tremendous improvement in age spots that she has as a result of the resurfacing that we did for her. Again, a patient with deep acne scarring. This is before and after, And afterwards, if you're thinking in the audience, does she still have acne scars? Yes, she still has acne scars. I agree with you. And there's a few more things that I would have liked to do with her. But nevertheless, she looked so much better as a result of the header resurfacing alone that she didn't choose to have anything else done. She was sufficiently pleased, and I was pleased with her results, but I think we could have gotten even a little better if she had wanted. Again, another patient, you can see the deep lines both below the lower lip, above the upper lip, and the face is resurfaced. Again, the results are permanent. You have a permanent improvement, not just in the way the skin looks, but in the quality and the texture of the skin as a new skin forms to take the place of the old diseased skin. And you have new collagen formation, and that's what takes away the deep wrinkles.